Well, hello, friends. I hope you are having a wonderful week so far. And I am incredibly excited to welcome Dr. Pragna Dadhania again to the show.
Thanks for having me again.
Well, your first session on perimenopause, the first episode that we aired on perimenopause, was one of the most listened to episodes that we've
Wow.
had so far.
Wow, that's
So,
amazing.
and I had a ton of questions asking for you, a ton of people with questions emailing, asking for you to come back on the show. So, we're going to do quite a series.
Yes.
And today is going to be all about estrogen. And who is she to be talking about estrogen? Who is Dr. Pragna Dadhania to be talking about estrogen? She, first of all, she's my friend. That's her first qualification. Second qualification, she is an OBGYN, okay, a board certified OBGYN. And here, listen to this. This is why she qualifies to talk about estrogen to us today. She is a Menopause Society certified practitioner. That's what we need. So today, if you know anybody who wants to know all the scoop about estrogen, today is going to be a special episode on estrogen. And we're going to go deep in all around about estrogen. So are we ready to dive in?
We're ready.
She's
I'm
always
ready. I hope everyone out there is ready.
She's always ready. So we'll just go right in and do me a favor. If you're listening to this podcast, there's no woman in your life that doesn't have estrogen in her. Share this podcast with somebody special, some woman you love, some woman you want her to feel better about her body. So share this podcast with them. So we'll start from the beginning. What on earth is estrogen? What is it and where does it come from? Like this hormone estrogen, we've heard too much about it.
Right, right.
Yes.
So estrogen, it is a hormone. It is a signaling hormone. I think when you first hear estrogen, probably mostly women, we think about our periods or
Yes.
infertility. But really, it is a whole body hormone. Yes, it is important for our reproductive health. It is responsible for our periods. It's responsible for becoming pregnant. But it also does so much more than that. Estrogen really, it is a whole body hormone, like I just mentioned. It affects our brain, it affects our bones, it affects our heart, our skin. And so really, nothing in our body is not affected by estrogen. And it's primarily made by our ovaries. But we also get some estrogen from our adrenal glands, which are glands that sit on top of our kidneys. And then also fat tissue also makes estrogen. But the majority of it for women, it's coming from our ovaries.
Okay, so we have now learned that estrogen comes from our ovaries, some from the adrenal gland, and some from fat tissue.
Yes.
But majority from the ovaries.
Yes.
For the women. And when you say estrogen is a whole body hormone, what do you mean by that?
Yes. So what I mean by that is that we have, a hormone has to react on a receptor, and we have receptors head to toe. So an analogy that I like to use is that if we, that estrogen is like the COO of our body.
Okay.
The
I
CEO
like that.
is our brain.
Yes.
But estrogen makes sure that all these different departments of our body are working together. So estrogen is in charge of the brain department. It's in charge of our heart department, our muscle department, our skin department. And estrogen makes sure that everything is working as it should, everything's communicating properly. And what's interesting is that what happens in perimenopause when estrogen fluctuates, it's as if the CEO of our body is showing up late, taking days off, is sending mixed messages. And so these departments still continue to
we're in
work,
trouble. Yeah.
but they're not communicating. And so that's when symptoms start to appear, is when this communication breaks down.
I love that analogy. I love that.
Yeah.
So that is estrogen, the COO of the body,
Yes.
and it's not sending the right messages and it's not showing up on time at all the
Right.
right places.
Right. And sometimes it may give 150%, and sometimes it may only be there like 20%.
And so this is perimenopause.
And that is perimenopause.
So take us back again. So differentiate between perimenopause and menopause for people who do not know the difference between perimenopause and menopause.
So when we talk about estrogen in menopause, our estrogen levels have reached this critical low level where at that point, your ovaries don't ovulate, you don't get periods, you're unable to become pregnant. So our estrogen reaches this critically low level. But in perimenopause, our estrogen levels fluctuate day to day, week to week, cycle to cycle. So you could have a perfectly normal cycle one month. The next month, you may overshoot and your estrogen levels may be super high. Then it could be super low. And our body likes steady state things. It doesn't like these fluctuations. It doesn't like to be
I feel
high
the
one
body.
day, low another day, in between another day. Like that chaos is not good for us. And that's where, where we see symptoms and where we see, women ultimately suffering.
So when this varies in age for certain women, like with
Yes.
perimenopause, but I'm beginning to see women, in their late 30s to their 40s, beginning to have symptoms of perimenopause. When is usually around the time that you begin to see women with perimenopause? Around what age? Is there like a
So
general range?
there's a general age. So if we talk about, let me backtrack to menopause. So
Yes.
when you have gone, menopause also is 12 months in a row without a period.
Okay.
And in this country, the average age is around 51, 52. And,
Okay.
I do see it steadily creeping upward where
Okay.
I see women in their mid to late 50s still having, a couple of periods a year. But on average, around 51, 52. And if you think about perimenopause, it varies. For some women, it can start 1 to 2 years before that final period. Worst case scenario, it could be 8 to 10 years. And also within menopause, yes, I said the average age is around 51, 52, but 90% of women will enter between the ages of 45 to 55.
Okay.
So if we go at the younger age of 45, so if you were somebody who was destined to stop having their periods at 45, and then if you were also somebody who was destined to have an 8 to 10 year perimenopause, then yeah, we're subtracting 10 years from 45. And here we are at the age of 35 starting to experience symptoms. So it can be as early as your mid 30s.
So before we get to what we do when we start experiencing those symptoms, I want to, you said that whole body hormone, and it kind of intrigued me. So when you said it can affect our brain or our heart, let's start from there.
Yeah.
How does estrogen affect our brain?
Yeah. So estrogen supports our neurotransmitters, in our brain. So it
Yes.
supports things like dopamine and serotonin, which are sort of like our happy hormones,
Yes.
responsible for our mood. Estrogen can play a part in anxiety. So it's not uncommon for women in midlife to all of a sudden experience anxiety that they've never had before. And so it's not a sign of weakness or stress. Really, it's, our body is undergoing these physiologic changes. And I think one thing that is important to note is you can start to have symptoms even before your periods become irregular. And so being attuned to that is really important.
I love that you said it's not a sign of weakness. I love that you said that. It really, my mind stopped when you said that. So whatever you said after that, I didn't hear. But because you said when our estrogen begins to fluctuate and we begin to see signs of anxiety that we didn't have before, because estrogen is controlling all those happiness chemicals, the neurotransmitters, dopamine, oxytocin, serotonin, and endorphin. And if because the COO, I'm stuck with that.
Yeah,
I love
it's
that.
a great analogy.
The COO is sending mixed messages. And so it's not sending consistent messages, and it's showing up some days full 100%, some days it's showing up 20%.
Yes.
That is such, I've never heard it put that
Yeah.
way before.
Yeah.
I'm going to use that a lot with my
Yes.
patients. So, but it's easy to understand that. So now what happens is that the body gets confused, the brain
Yes.
and this happiness chemicals, all the neurotransmitters, and not fully supported
Right.
by the estrogen.
Yes.
And this is what triggers that anxiety to start showing up
Yes.
in perimenopause.
Yes, as well as it's also common for a lot of women to experience brain fog or concentration problems, memory issues, all common, all influenced by estrogen and its effect on our brain.
When you said estrogen is a whole body hormone, you got me there. I got stuck with that. I'm taking the estrogen is a COO, and then it's a whole body hormone. And so, and you said it's affecting our brain. Can you expatiate on that? Can you tell us how it affects our brain? Because I see a lot of complaints when they come to the pharmacy.
Yeah.
Can you tell explain to us how it affects our brain.
Yeah, so estrogen has a huge impact in our brain.
Yes.
One, when it comes to mood. So estrogen, works with our neurotransmitters and
Yes.
keeps things like dopamine and serotonin in balance. So those are sort of our happy hormones.
Yes.
And so when estrogen fluctuates and dips, it's affecting how much serotonin and dopamine we produce. And that's going to affect our mood. So we can see mood swings. So again, as estrogen fluctuates, it's high, it's low. It's not surprising to find that we'll have mood swings. Estrogen is also, plays a part in cognition. So things like it's not uncommon for women that I see will complain of brain fog. They don't feel as sharp as they used to be, trouble remembering things, trouble focusing on things. And this is all, what's going on at the level of our brain and with estrogen fluctuating.
Yeah, I love that. I really love the COO analogy but I also want our listeners to remember that estrogen is not a solo acting hormone in this whole show.
Yes.
There are a couple of other things that we need to pay attention to, especially as 30, 40, 50-year-old women in this space. We also want to be checking our B vitamin levels. If your B vitamin levels are very low, you're going to have that brain fog. If your ferritin levels are also very low, you're going to have low energy as well. So, and vitamin D levels. So a lot of things come into play and not just estrogen. So we want to do a whole look at your whole body. And that's one of the reasons why we encourage the women to do the journeys testing, which literally tests about 125 different biomarkers that in addition to what's going on, it also tests your estrogen levels, vitamin D, B12, ferritin. We get all these tests and then we're able to see a really clear, complete picture of what's happening to you. And then we can go deeper into other things that you said estrogen contributes to fat distribution. Can you tell me more about that?
Yes. So, the dreaded weight gain that, we see in midlife, unfortunately. So, estrogen plays a role on fat distribution and in perimenopause and menopause. I'm sure any woman can tell you who's kind of entered that stage is that, you're going to get the weight gain in the midsection. And that's, that's due to the estrogen fluctuating and dipping. Estrogen also plays a part in muscle mass and preserving that. So once our estrogen levels dip and fluctuate, we're also going to see that it's going to be harder to gain that muscle and preserve that muscle we have. So again, all the more importance that we really need to pay attention to our diets and movement and strength training because we need to kind of compensate for this loss of estrogen.
Yeah. It just, when you're saying that, it just reminded me of a couple that I was working with in a 2-month coaching program, and they were working with a trainer, and they were doing the same workouts and everything, and just the same eating and nutrition, movement, and everything. And the guy was able to lose more body fat and gain more muscle, and the lady, she improved, but not as great as the guy. And she was like, I hate you. I'm the one that brought you this program because she's the one that initially came and consulted with me. And she was like, my husband should do this program too. And, she lost about 17 pounds, in that 2 month of coaching. And she gained some muscle, but not as much as her husband.
Yeah.
And so she was like, you owe me because it's really funny but we take into consideration that, that our muscle is already declining.
Yes.
But we need to work against it. We need to work to be able to build muscle. I'm glad you brought about that muscle part because I always talk about muscle being the currency for our future.
Yes.
As we prepare for aging, we need to be building muscle because sarcopenia, we don't want that in the equation. So, but with that part, with the brain health and then with the fat distribution and building muscle transitions my mind direct to cardiovascular health. So how does estrogen play a part in our heart health? And I know you're very passionate about cardiovascular health.
Yes. And
let's talk about.
So heart health is incredibly important.
Yes.
If you don't know by now, I'm going to say it again. I think I've said it before on this podcast. Heart disease, it's the #1 cause of death for women, more than all the cancers that affect us combined. So I know a lot of times our mind goes to maybe like breast cancer, but really heart disease is the #1 cause of death. So super, super important.
I'm going to pause you right there. I'm sorry to interrupt,
No, that's
but
okay.
I really want you to say that one more time because a lot of times, Dr. Dadhania is our OBGYN. She's menopause certified. And so she works with all our ladies who come in, do our journeys, and kind of she helps them balance those hormones, prescribe if it's need a patch or need she assesses, with whole person health, subjective, objective data and everything, figures out if you need estrogen, testosterone, progesterone, and things like that. But she just said that cardiovascular disease, because every time I know this about her, she always says, every time I'm talking with her, she goes, cardiovascular disease kills us more than all these cancers put together. So she focuses a lot on her health.
Yes.
And I just love that about your practice. I love that. And your practice is named Modern Menopause Care.
Yes.
Like, I want to ask you before we go deep into cardiovascular, does this have something to do? Why did you come up with that name, Modern Menopause Care?
I think I came up with that name just because I wanted to kind of illustrate that the way we care for midlife women is changing, and we need to take a different approach. So it's not just hormones, yes, that's one aspect of it, but it's all these other things. It's our heart health, our bone health, our muscle health. I think a lot of women now, we're really interested in increasing our lifespan and our health span and having this chapter of our life where we're fulfilled, we're able to do all the things we want to do, be able to play with future grandchildren, travel, and I think, a lot of us, unfortunately, women in the previous generations, because of the Women's Health Initiative, because estrogen had such a negative connotation, our mothers and grandmothers didn't have access to some of these things. And I think a lot of us have seen, oh, I don't want to be like my mom, or I don't want to end up like my grandmother. I don't want to break, I don't want to fall and break my hip. I don't want to be in a nursing home. Like, I want to be traveling. I want to be gardening. I want to be biking and walking and doing all these wonderful things. And I think women are now realizing that. So we have to address more than just hormones. It's everything.
Yes. I love that.
Yeah.
I love that. I love addressing more than hormones. And this is a perfect time to remind you guys of our journeys testing, because our journeys testing, the middle one tests all your cardiovascular risk factors, your lipids, the full lipid panel, ApoB, LP(a), and your particle sizing. So we do all that testing, including your hormones, and we look at a whole person health. And then we take back to the steps of intentional living, all those pillars: nutrition, movement, inner alignment, positive social connections, to be able to care for you. Well, tell me more about the cardiovascular support that estrogen gives. Yeah.
So estrogen in our younger years is incredibly cardioprotective. It's anti-inflammatory. We see changes starting in perimenopause with estrogen. So even things like your cholesterol can start suddenly increasing, your LDL, your triglycerides. And so all these numbers, you could, if you're tracking your cholesterol, you could have the same diet, same exercise, and all of a sudden your cholesterol is creeping up. And, that is a product of estrogen, because estrogen influences, it's involved with cholesterol management, and which then in turn affects heart disease. And, one of the health benefits of estrogen replacement, we know, is that the closer you are to menopause and the younger you start estrogen replacement, if that is something that you decide to do, it does reduce your risk of heart disease, which again, like I said, the number one cause of death. So not only is estrogen there to kind of help make us feel better from things like hot flashes, mood swings, but it also is providing us this longevity benefit as far as when it comes to heart disease. And again, that key is especially if you start within the first 10 years of menopause. In the menopause world, we kind of talk about this window of 10 years. So starting within the first 10 years of menopause, as opposed to 15, 20, 30 years later, where as we age, estrogen may not be the best thing, but when we're younger, it is incredibly cardioprotective.
I love that. I heard estrogen is cardioprotective, and that stuck with me. I love that. I want our listeners to hear that part. Estrogen is incredibly cardioprotective. Another thing that's cardioprotective, your HDL levels. And so for this cardiovascular disease, that HDL, that is very closely linked to exercise. Move your body.
Yes.
Move your body. and help that estrogen to support those neurotransmitters and help. And if you are a candidate for estrogen replacement, first 10 years, and that's where so don't delay. As women, we spend a lot of time taking care of everybody else and all the children and all the rest of the world and the entire community, but we got to prioritize ourselves. You got to do your testing. You got to consult with a doctor, sit down and talk with a healthcare provider who knows what they're talking about when it comes to hormone replacement if you're a candidate for that, so that way you can feel better. One of my friends just texted in the group chat the other day and she said, oh my gosh, Emma, thanks to vitamin D and estrogen, I am able to move my body and get up and go on days that I'm even unmotivated. Before that, I was like struggling to crawl out of bed. And I just laughed and I said, I'm so happy that she did journeys and we're able to help her with this. So I'm incredibly grateful for the women who are prioritizing themselves. That's the only way we're going to have a better community and a better world, because we take care of ourselves and first, and then take care of the people around us. All right, one last support that I know there's numerous things that estrogen helps us with, but I don't want us to end this podcast without talking about bones. Bone health. Tell us about the benefits of bone health.
Yeah, so again, estrogen, incredibly protective of bone.
Yes.
And we can even see, when estrogen starts fluctuating in perimenopause, so even before that final period, we are rapidly losing bone. And it continues, again, at that menopause transition. So estrogen is really great for our bones. And when we lose that estrogen, our bone strength starts to decline rapidly. And so, another benefit of estrogen replacement is that it can be used for the prevention of osteoporosis. And I know you know this, and I've heard you say this numerous times, but yes, 1 in 2 women, or 50%, that's 50% of women, will suffer from a fracture due to osteoporosis. And that is huge. There's not a lot of things that affect 50% of us. And it can be preventable with things like our calcium, our vitamin D, building up that muscle and bone density through exercise. And yes, estrogen can be an added tool for that. It's very, disheartening to me sometimes, when we check bone densities on women, mid 50s, maybe early 60s, and they already have evidence of osteopenia. And, I think now with all that we talk about, again, whole body health is really in our 30s and 40s, really focusing on bone health and doing strength training and doing training that stimulates our bones, things like jumping, is really important as well.
This podcast is sponsored by Journeys, your path to intentional wellness. Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is speaking to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different journeys to choose from, each designed to meet you where you are in your wellness path. The Core Wellness Journey for $199 offers a foundational look at your overall health, perfect for getting started and measuring 66 biomarkers. The Advanced Heart and Metabolic Health Journey for $339 measures 111 biomarkers and goes deeper into cardiovascular, metabolic, and thyroid health for a more detailed picture. The Comprehensive Longevity and Hormone Journey costs $469 and is the most complete view, including hormone, nutrient markers that support energy, balance, and healthy aging. This measures 120 biomarkers. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to help you turn results into lasting intentional change. You just won't get data. You'll get guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. I cannot stress this enough. You heard it. It's not a lot of things that affect 50% of us. And that's not even the worst statistic. Out of that 50% who have that fracture, that osteoporotic fracture after age 50, 20% go on to end up in the hospital and end up with hospital-acquired pneumonia and other things as they have that osteoporotic fracture.
Yes. I mean, imagine if you're, in your 80s and you fall and you break your hip. There's lots women who die within that first year.
With that first year.
Yeah.
So this is not something that we want to wait and let it happen to us. Be proactive with your health, support your bone health with
Yes.
estrogen. So we've talked about all these ways that it supports. So if you are can you walk me through how you determine if a lady is one of those who will benefit from estrogen? Because we've heard a lot of bad reputation on
Yes.
hormone replacement therapy. So
Yes.
clear it for us and let's hear.
Yes, I would say probably the majority of healthy women are probably going to benefit from estrogen therapy. Yes, estrogen in the past has had this negative connotation. So I think, most women, like I said, are probably good candidates. So I'd say women who probably are not good candidates for estrogen replacement, I wouldn't even say high risk for breast cancer. I would say, if you do have a diagnosis of breast cancer and you're in the, if you're in the midst of treatment, then you're not a candidate.
Yes.
If you've had like a prior stroke, you're probably not a good candidate. Maybe if you've had a prior blood clot, like a DVT or a PE, so that's a blood clot in your leg or your lung, but there's still nuances with all of that. So there are still cases where you could be a candidate. So if you're somebody who's, living a healthy lifestyle, you're not, you don't have breast cancer, you haven't had a heart attack, you haven't had a stroke, chances are you're likely a good candidate for estrogen replacement. And that's something where, we really need to break it down and talk about the individual woman's risks, benefits. Is there a family history of breast cancer? Is there a family history of early onset cardiovascular disease? And for most women, there isn't. And so they could be a great candidate, not only to feel good on estrogen, but also to get all these health benefits as far as the bone and the heart, which again are huge. And so I would say most women do benefit. And it's really, that's where I kind of look at their histories, look at any of those risk factors, because really if you're not smoking, you're exercising, you're watching your diet, your cholesterol's fairly well controlled, you don't have diabetes, your blood pressure is under control, then yes, you would be an excellent candidate. And so that's where we kind of have to look at all of that. So it's very individualized. It's not one size fits all that every woman should be on estrogen or nobody should be taking estrogen. Really, it's looking at everything and also, looking at some of these biomarkers, looking at seeing what is your risk for developing some of these things. And everything is kind of a calculation, a risk-benefit calculation. And as long as you're benefiting more than risking, then it's probably worthwhile to be on it or continue.
I love that. I love this very individualized approach that you have. And that's really what the patients benefit from.
Yes.
And but I have a question for you about bone density. Around what age do you recommend women get their first bone density scan? Just give me a range.
Yeah. So I would say first I'll throw out there right now the recommended guidelines are average risk women to start at 65, which in my opinion is too late. And honestly, I've been finding a lot of insurance companies are covering it much younger for women. So, if you're in your mid 40s, late 40s, and your insurance is covering it, I say go ahead. Definitely if you've been, if you're already in menopause, I think that's a great time to check. I think the earlier the better. And it's not, when we talk about medical testing, it's not so expensive. So I think even if your insurance does not cover it, I do think it's probably a worthwhile test to get done because it can give you so much information. And because our bone mass does peak in late 20s, early 30s, so that, even by the time you're in your mid 40s, like I said, it's not surprising. Sometimes I already see women with osteopenia and it's like, oh gosh, I wish I would have known this 5 years ago. I would have paid more attention to this. And so I think the sooner the better. I would say anybody certainly mid 40s and beyond is somebody who would qualify in my book to start testing.
I love that. But if we were going by general guidelines, we wait until women celebrate their 65th birthday before we do a bone density scan. That's not an expensive test. That's a test you can go in and do. You heard the lady. She said, go ahead and do that test earlier because we don't want to wait until you're 65 and then we do a bone density scan and say, oh my goodness, you have osteopenia or you already have osteoporosis. What happened? We could have done it earlier,
Right.
and we would be able to increase your strength training. We would be able to recommend you start vitamin D. We don't wait. You don't wait until you're 65 to start your vitamin D and calcium. So I think right now will be a great place to transition to supplement school with Emla.
Okay.
And so, Dr. Dadhania, what supplement is on your mind today?
So, considering everything that we just talked about and how we talked about estrogen's role in bone health, so what's on my mind then is what can I do to help with my bone health? So I'm thinking about calcium, vitamin D, and I know I learned from you the importance of K2 with the calcium, which was something I was not so familiar with before.
Leave it to Dr. Dadhania to, instead of giving us one supplement, I asked her what supplement is on your mind, and she gave me 2 supplements on her mind. So you heard, I'm going to follow my doctor's orders, and she said calcium with vitamin D3 and K2. So that's what we're going to be talking about today, without question. Every woman should already, if you put on one side a multivitamin, on the other side calcium and vitamin D3, K2, without question, I'm taking calcium with vitamin D3, K2. Reason being that I want to enhance my bone density. My bone density peaks in 20s to 30s. 20s to 30s, and then we start going down.
Yes.
After 30, we start going down. And then your bone matrix is not as nice and firm as it used to be. It starts becoming porous. And then that's when we call it osteopenia. And osteopenia is just one step before osteoporosis. If you do nothing, you head into osteoporosis. At that point, the doctor will do your bone density scan and say, oh my goodness, you have osteoporosis. Let's give you a prescription for Fosamax. You're going to take this once a week. You're going to take this once a month, or you're going to have to stay upright for 30 minutes after take all the side effects of the biphosphonates. And we want to protect. We want to prevent. We don't want to get there and start treatment. And number one that you could do is strength training. So you could take all the calcium and all the vitamin D3 you want. If you're not strength training, you're not doing the best for your body. You're wasting your time, energy, and money. So in addition to, you've heard me talk about this before, in addition to your calcium and vitamin D3, K2, and again, we have the episode that aired. We have an episode which I will put the link into the show notes about vitamin D3 with K2, why it is important to take D3 with K2. It is only 17 minutes, that episode, and so you have no reason to not listen to it, because we as women, we should all be taking vitamin D3 with K2 unless we're on warfarin. And so please listen to that episode. I will link it in the show notes. But vitamin D3 with K2, making sure that K2 is enhancing calcium to go to the bones where it belongs, to strengthen it instead of depositing it in our arteries, because we do not want calcium in the soft tissue. We don't want calcium in the soft tissue like kidney, because that causes kidney stones. We don't want calcium in the arteries because that causes calcification, increases risk for atherosclerosis and plaque. We don't want that. We want calcium in the bones to strengthen our bones, prevent osteoporosis. So D3K2, that is something that I take, and that is something that I highly recommend that every woman take, whether you've had your bone density scan or not. It's being proactive, it's being preventive, so we don't wait until we're 65 for that. So if you were to give us one practical nugget, just one thing to change, an intentional initiative for the women after listening to this podcast today, what would your advice be?
So I would say start tracking symptoms and see where you're at. And, I did mention earlier in the podcast that you can have symptoms before your periods become irregular. So you could be a woman there in her mid-30s and you might still be having regular cycles, but I would pay attention to anything that you feel is starting to become off and start tracking in relation to your periods. So I think that's a great next step. I mean, I feel like there's a lot of great next steps, but I think, that's a good one as far as where to start, and not to blame yourself. Just realize that physiologically, this is what's happening to estrogen in our body, and it's nothing that you're not doing or you are doing. It's something that's sort of inevitable, but we do have lots of options from lifestyle, non-hormonal, hormonal things that we can do to kind of help navigate, this time period in our life.
I love that. I love that. You heard Dr. Dadhania. She said, track your symptoms, track what's going on, track the changes. And we have created a beautiful place for you to track those changes in. As you And as you in our intake for journey, so when we do our testing to get our objective data, we ask you all these questions to put in all these answers. You know, how you're feeling, the mood, the anxiety, the constipation, diarrhea, all the sleep, waking up at night, difficulty falling asleep, brain fog, fatigue, and all these things. You put in all these questions once you intake for journeys, and you answer all those questions. Then you have your blood drawn, and then we measure all those biomarkers, your vitamin D, your ferritin, your estrogen. Once we measure all that, we have combined data, subjective and objective, and we put it together, sit down with you for 20 minutes at least, and then we interpret this data before we send you over to Dr. Dadhania to be able to look at the hormonal aspect. So that way you are taking action. You're not just gathering all this information, listening to all these podcasts and doing nothing. Taking action is what's going to bring change.
Yes.
It's what's going to make you feel better. Take action. Click on the journeys link, schedule your journeys today, and take action to prioritize your health. Thank you very much for listening. Share this podcast with somebody who you think will benefit from this. And Dr. Dadhania, I cannot wait to have you on to talk about progesterone.
Yes.
Is that the next
That's
hormone?
the next one. So yes, I'm excited to take this deep dive. So yes,
I love it.
progesterone's on deck.
I love it. Progesterone is on deck, and we will also be putting Dr. Dadhania's contact in the show notes. If you want to reach out to her directly, click on that and schedule your appointment with her. Please take care of yourself. Live with intention. Be kind to your body.